Hello, my name is Chiamaka Olivo, and I will be conducting this interview. Nice to meet you. How are you?
I'm good. How are you?
Good.
I'm Spencer.
Nice to meet you. Do you want to tell me about yourself?
Yeah, my name is Spencer Brady, and I am interested in science, healthcare, and learning how to help people. And I would describe myself as hardworking, dependable, and motivated. And I take my goals very seriously and I try to stay consistent. I like being challenged and learning new things, and I work well with other people, and I like to say I stay calm under pressure. I've had a bachelor's in biology from ASU, and I believe has helped me become more mature and disciplined in life. And I'm excited to keep on growing and pursue a future in medicine.
And that was a great answer. Why do you want to get into medicine, and why not be a PA, or why do you specifically would like to be a PA instead of a doctor or an NP?
So I would like to go into medicine because problem. I enjoy science, problem solving, and help people in a direct way. And I've always been interested in science and how the body works. And I want a career where I can help people in a direct and meaningful way. Um, and the PA role, it stands out to me because it's team-based and patient care. And I like how PAs work closely with physicians, but still have an active role in diagnosis and treatment. And the flexibility of the PA professionalism is important to me because it allows allows growth across different specialties as well.
That's great. If you couldn't be a PA or couldn't go into PA school, what would you do?
I would still pursue career in healthcare. I would look for a role where I can continue working directly with patients and something where I could use that time to build more hands-on experiences. Something that my dad does, he's a dentist, and I'm actually very interested in that as well, specifically as a dentist anesthesiologist, but it is very, very competitive. Um, but that's something I'm also interested in.
Tell me about a time you cared for someone beyond just their medical needs.
Uh, I made sure to listen to what they're feeling emotionally, not just what they need physically. And I try to make them feel comfortable and supporting them during a stressful moment. And I paid attention on how fear or uncertainty was affecting them and say, um, also with this, I have a specific person in mind. This person, he had autism, and I had to keep that in the back of my head and approach him with more patience and care than I would with someone who didn't have that.
My brother has autism, so thank you for just being kind to people that are a little different.
Yeah.
Um, would you like to describe a time that you worked with an interdisciplinary team? I know you talked a little bit about how PAs fit that role. So how do you, in your current position or you navigating life, how would you say you fit that role currently?
An interdisciplinary team?
Mhm.
What do you mean by that?
Um, PAs work collaboratively with a lot of people, so how would you say you work in collaboration with a team?
Oh, okay. I see what you're saying. Um, so I would think back to my job when I was an orthodontist assistant. There was a lot of different assistants, and we all had a same role, but there was a lot of team involved activities and like, oh, hey, can you do this or can you do X, Y, and Z while I'm working on A, B, and C? So there was a lot of back and forth going on. And even though there's a lot of back and forth going on, I was able to work with people who had different responsibilities and perspectives. And I learned how important communication is when there are multiple people involved. And I also saw that teamwork leads to better decisions and better outcomes. So, I'd say that's my time working with an interdisciplinary team.
That's a great example. Would you like to describe a time that you helped reduce a barrier to care?
Um, yeah.
I know you talked a lot about working in a team, so do you have a specific patient, HIPAA compliant, that you can share a story with, or things that you've witnessed maybe as you've shadowed?
Yeah. Uh, so I'm sorry, what exactly do we mean by reduce a barrier to care?
When I think about reducing a barrier to care, I think about just assisting maybe a patient or a family member or a friend get a with a, receiving better care. So, for example, my brother has autism. Something that I really like to do to reduce barrier to care is a barrier of his is communication. He has a very
Mhm.
difficult time communicating. So, reducing barrier to care would be like maybe assisting him to his appointments. My other cousin, he's deaf in his left ear. A barrier to care would be I would make sure to describe to any doctor or any interaction that he's having to maybe go to lean towards his other ear, or I would sometimes sign ASL to help
Oh,
communicate.
okay. Yeah. So I would try to simplify information and make it easier to understand if they, for instance, had autism or some sort of disability, and just make it so the steps that they have to take are more clear and more manageable. And I'll try to consider it from their perspective and what might make it hard for that person to follow through and try to fix it from their perspective and try to reduce any confusion by explaining things in a straightforward way. And if there's a parent or a guardian involved, I would explain it to them as well.
For sure. Thank you for that. Would you like to talk about a time you demonstrated compassion in a difficult situation?
Sure. Um, I would say I took uh I took a trip to Mexico. It was a healthcare trip, and I was working as a dental assistant, just getting volunteer hours. And it wasn't necessarily a difficult situation, but I saw how it was a difficult situation for the people down there, and helping them out was a great thing. And uh, and I just try to show compassion through, my body language and patience. And even though we had two different languages, there was that language barrier. I try to, communicate through them using Google Translate, or we had finally the translator came, but they were like an hour late. But that's what we did for the first hour. And I try to make it so I'm the type of person, even though it was a hard situation, I try to do my best to make it a little bit less overwhelming for the people that were involved because they were in pain and they were wanting to get treatment done ASAP.
Yeah.
So I was trying to communicate with them with that.
That must have sounded like a really rewarding experience getting to, go to another country and experience health disparities there. So thank you.
Yeah.
Do you know why you would like to go to ATSU specifically?
So ATSU has a strong reputation in healthcare, and I like how it emphasizes in whole person care. Um, and also the school of mission aligns with my value with service and compassion.
Yeah.
And I appreciate how they focus on caring for underserved populations as well.
That's amazing. What kind of PA would you like to be?
Honestly, I have no idea, and I'm going to just keep it wide open and just whatever suits me, I'm going to just flow into that naturally, I believe. So I'm going to just let that happen.
I think that's the great thing about being a PA is you can kind of put your foot in many different doors.
Yeah.
So going into PA school and talking about PA school, how do you feel like you will handle a rigorous academic program?
That's a good question. I'd like to say I stay organized for the most part. Um, and when I have to, I can manage my time carefully. And I know that consistency is important, so I would try to stay on top of that. And I would do my best to break down big tasks into like smaller tasks as well. And I would definitely keep a schedule, Google Calendar,
Yeah,
have everything lined up, keep that in check and make sure I'm on top of things. And I would just need to be disciplined about myself and make sure my crap is together.
absolutely. And do you have any questions for me?
Let me think. What type of qualities do you think make someone successful in this program?
That's very interesting. I think for such an academically rigorous program, I think qualities that we would look for is somebody that's incredibly kind, compassionate, as well as somebody who takes initiative. I think because it's such an academically rigorous program, asking for help when needed and being sure to communicate with us as your academic advisors is something that we really look for in a student.
Okay. All right. Sounds great. Thank you.
No problem.